How long would you recommend off of work for a diastasis repair stroke tummy tuck? Okay. Oy. So if you're on your feet a lot, and you can't limit your shift times, then I'd probably say somewhere like 4 weeks.
Are you lifting people? Are you I guess we need to know a little bit more about your work and what you're doing.
Are you a nurse? Are you a doctor? Are you a sort of an allied specialist? I don't know what you do. But if I'm just sort of getting this general sense that you're on your feet and midwife, right? Okay, so you are on your feet and busy all the time. Yeah, so it might be possible to. We've operated on a fair few midwives.
We have.
We've operated on a fair few midwives.
Actually, we could buddy you up with
exactly what I was going to say. One of the things that we do is every time we have a patient who is discharged, but you're never discharged, it's an open appointment, but we don't routinely call you back anymore. So every time we have a patient who we are at the end of their pathway, we say, by the way, would you mind being a buddy for other patients? Would that be okay with you? And almost everyone says yes. So you can imagine we've got this huge database of buddies, and we can pretty granularly match you up with someone who's having the same procedure as you, with the same concerns as you, with the same job as you, with the kids of the same age as you. You know, these people we match up are actually often so well matched, they become really good friends.
Yeah, they do.
We'll not infrequently turn up for surgery, and the patient is being dropped off by a previous patient of ours who have made friends.
It's lovely.
It is absolutely
so
lovely.
nice.
And we say, oh my God, am I seeing you today? It's like, oh, no, I'm just dropping them off.
We've got a patient at the moment who's finished her journey, and she's buddied up with a patient who's having surgery next week.
Oh,
I know. She's emailed saying, "Oh, I'm just so excited for her."
Oh.
And, they're talking all about it and what to expect. It's fair enough. We can tell you from our side, but we haven't had this stuff done. We don't know. You know, we know what we know, but we don't know that side of things.
Yeah.
And so it's really nice for patients to have someone who's been through it.
Yeah.
And I think particularly when they have the same concerns.
Yeah. No one knows what it's like to be a midwife better than another midwife who has had the surgery and gone through it. They are just perfect for you. But yeah, I would guess 3 or 4 weeks.
Yeah.
Probably. But you can tie that around kind of some holidays or Christmas holidays plus annual leave. Plus a bit of sick leave. You can take sick leave. You can self-certify for a week of that. So there's all sorts of ways of managing that.
Can you sign, for example, a midwife off for longer than 1 week? Can you give a letter to say?
Yeah.
Okay, so you could have a doctor's letter to
say.
say.
Oh yeah. On the doctor's note thing, by the way, a lot of people want to keep their surgery private. So I can only write a letter from me. I can't sort of say from Dr. Smith, haematologist, or something. It will come from me, and it will say my name and I'm a plastic surgeon. It doesn't take a genius employer to Google me and work out what the majority of my work is. So some patients don't really want that. So I will always issue a sick note, and it's my sick note, and it's from me, and that's really all I can do. But patients are able sometimes to take that sick note to their GP and have it reissued from their GP, simply saying, I've had surgery and they need 4 weeks off work. So I can't promise it. I don't know your practice. I don't know I don't know what it's like. But we know that's worked for a few people.
That's really good to know.
There you go.